Ebola is a deadly disease caused by infection with one of the Ebola virus strains. Africa has 4 strains of Ebola that include Zaire Ebola virus, Bundibujo Ebola virus, Thai Forest Ebola virus, and Sudan Ebola virus. All of these strains can cause serious illness and death.
Because all of them really manifest the same. What we know, it is also severe. Last time when we got to Congo, Sudan, we lost quite a number of people. So people need to be reminded that their responsibility of safeguarding and making sure that this infection is controlled also lies with them, to take extra precaution, to make sure that anyone who falls sick is reported.
Uganda has had several Ebola outbreaks, with its first experience being in 2000, where the index case was confirmed from Gulu district. This outbreak is described as one of the most devastating epidemics, where 425 cases were recorded, with 224 deaths representing a fatality of 53%.
An official, I think in the Ministry of Health, rang me in the evening and said, we have a hemorrhagic fever, that's what we call them, a hemorrhagic viral fever in Gulu. We don't know what type it is. This was, of course, very bad news. So I said, fine, I'll be coming to Gulu with my colleagues at the ministry. But that evening, I rang the head of state, President Museveni. He said, we've been attacked by a hemorrhagic type of disease in Gulu. We don't know what it is.
Other countries that have had the worst Ebola outbreaks are West Africa and the Democratic Republic of Congo. Uganda last had an Ebola outbreak in 2022, where the first case was reported in Bumende district, and then spread to 9 other districts before it was contained within 42 days, following improved response over time. Now, Uganda is on high alert again after the Ministry of Health announced an outbreak of Ebola Sudan strain that has claimed 1 health worker. The signs and symptoms of Ebola include nausea and vomiting, red eyes, severe headache, cough, diarrhea, fever, rash, and chest pain. However, it can be prevented by avoiding high-risk areas, regular hand washing, and avoid contact with an infected person or fluids. In order to contain the just announced Ebola outbreak, the Ministry of Health has put in place a number of measures, including activation of the country's incident management system and heightened surveillance.
Our regional emergency operation centers in Kampala and Mbale to work 24/7 to continue to do active surveillance. And we have also activated our task teams in the respective places to make sure that they are on high alert.
The Ministry of Health has therefore urged the public to be alert, calm, and observe standard operating procedures. Mary Namkose, Adiah Nakuti, UBC News.